weekend, Ghana will be joining the rest of the world to mark Neglected Tropical Diseases Day, simply NTD Day. NTDs are a group of about 20 parasitic and bacterial diseases which affect about 1.7 billion people in about 149 of the poorest countries in Africa, Asia, and Latin America. These diseases include trachoma, intestinal worms, river blindness, bilharzia, elephantiasis, leprosy, yaws, and many others. Most of these diseases do not kill, but then they produce unbearable effects. Ahead of the day, we discussed the celebration of the second World NTD Day, which falls on 30th January 2021. In the studio with me is Dr. Joseph Opari. He's the Deputy Program Manager for Neglected Tropical Diseases Program. First of all, he'll tell us about neglected tropical diseases. I've given you a few of the highlights, but let's take a look at what the current situation is in Ghana. Doc, you're welcome. Do tell us.
Thank you very much.
Do tell us the current situation when it comes to NTDs in Ghana.
Right. As you rightly said, NTDs are a group of infectious diseases that threaten about 1.7 billion people living in the poorest and marginalized communities worldwide. In Ghana also we have NTDs. We have 14 NTDs in Ghana. Some of them, as probably you rightly mentioned, are Borrelia ulcer. We have lymphatic filariasis. We have onchocerciasis, we have leishmaniasis, we have leprosy, we have rabies, and so forth. There are 14 in all. Okay. Most of these conditions have been mapped already. When we say mapped, it's like we know where the conditions are, and we've been managing them.
Maybe we can go a little bit into the management of these cases. How have we managed them so far? If you want to group them, or whichever way you manage them, can you share with us so we figure out how we're doing, if we're doing well?
So basically we have two groups.
Okay.
The first one is managed by preventive chemotherapy, which means we do mass drug administration, whereby we go to the communities and we give the entire community medicines against the condition. Mostly we deal with schistosomiasis, we deal with onchocerciasis, lymphatic filariasis, scabies, and so forth. Then we have other conditions whereby we look for the cases like Borrelia ulcer, leishmaniasis, yaws, leprosy. We look for those cases and we treat them. Yeah, so we manage case by case. So the two groups, one is, we manage one with preventive chemotherapy. We go and give mass drugs in the communities, and another group, we look for the cases and we treat them.
So in this year, as we celebrate, World NTDs, what exactly is our focus as Ghana?
Well, the theme for the celebration is face NTDs and end the neglect. It's like we want to create awareness about neglected tropical diseases. These disease conditions affect the poor. Okay. You see, people who lack the political voice, people who live in extreme poverty. So we want to create awareness that, to the entire population, that we have these conditions that we want everybody to buy in, come and support so that we fight against them. We get them eliminated in our communities. Okay. NTDs do not kill. That is one thing. But they affect the community members. And eventually some of them may be disfigured. And some of them may be disabled and so forth. So you want to get, and stigmatization is another area that many people with neglected tropical disease face so much. Because of that, it is difficult to show up in public and so forth. Example, people with lymphatic filariasis, they end up either getting...
Which is elephantiasis?
Elephantiasis, big legs, okay? Yeah. Some of them even get hydroceles. Some of them get big penis and so forth, right? And when it happens that way, it's difficult for them to come in public. All right,
so it's even difficult for them to go out there and seek help. Exactly. So what you're trying to do with this particular observation of World NTDs is to create awareness for people to reduce the stigmatization and for people to be bold enough to step out and seek help. Exactly.
We also want partners to come in and buy into the program because the government cannot do it alone. We need partners to come in and support in diverse ways. Most of the medicines that we use are donated. For lymphatic filariasis, ivermectin donated, albendazole donated, right? Schistosomiasis, praziquantel donated. We need to motivate the volunteers who distribute these medicines in the communities. And all of these demand a lot of money, and there should be all hands on deck so that we can deal away with these conditions.
So what are there any, is there a list of programs that will be, doing as Ghana to observe this day?
Yes, there are so many programs, and one is what we are facing now. It's like we are creating media awareness, right? And many of our colleagues will go on the various media platforms and advocate for that. We are also going to have public lectures on neglected tropical diseases on Friday. Okay, although the day falls on a Saturday, on Friday there's going to be a big derby at Aliza Hotel.
Wait, with the COVID-19?
Well, we've managed to, we are going to put all the protocols in place, preventive protocols in place.
That's if by then we don't already have a lockdown.
We pray that it never happens, although some people are advocating for that.
Okay.
We pray that it never happens. We pray that everybody puts on their face masks and observe all the preventive protocols so that we wouldn't get there. That is our prayer.
So let's finish with the programs. You were telling us, so you're talking about the big
Derby at Aliza Hotel.
Okay.
And with that one, we expect about 170 people, health workers, partners, community members to gather so that we create more awareness on neglected tropical diseases.
Okay.
Yeah.
Well, are there any other details you want our viewers to know? Otherwise, we'll call it a day for now.
Okay. Thank you so very much. Yeah, I wanted to say that neglected tropical diseases are also diseases of public health concern. Although they do not kill, they affect the poor in the communities, right? And at the end of it all, although at the early years of a person's life may not see the clinical signs and symptoms of the disease, at the end of it all, during the adult age, some of these conditions may appear. Okay. So my very first concern is whenever there's a mass drug administration against some of these disease conditions, we expect that the community members come on board and accept the medication, right? We also want to create more awareness in such a way that we get more partners to come and buy into the program. And we also urge the government to put a certain budget, in addition to all the good things the government is doing, add more money to support neglected tropical diseases. Okay. Basically, yeah. Well,
if you haven't, every year we have this conversation, and the idea is to get people on board to help you understand that we may be dealing with HIV, we may be dealing with COVID-19, we may be dealing with malaria, etc. But there are also these tropical, neglected, as they call it, tropical diseases that are also impacting our people and impacting lives. So let's be on the lookout for that, and hopefully you've learned something and you will share it with your friends as well. But as they said, they're looking for partners and volunteers who will help with the process. Dr. Joseph Opare is the Deputy Program Manager, Neglected Tropical Diseases Program there. Doc, thank you very much for coming once again.
Thank you.